Welcome again to Engage Now, which is part of MedCity's Engage conference. We have constant conversations going on at the conference in our networking sessions. My name is Seper. I run MedCityNews.com for Breaking Media, and I'm joined by Melissa Hutchison. She is with Allina Health, where she's leading their Öcare Copilot Institute and co-leads actually the health economics and program evaluation portion of Allina. They've been doing a lot with lay healthcare workers, and this is, as we talked about already in this conference we've had, there's technology and then there's the human touch. And so some of this is really just talking about the human touch, and Melissa, thank you for joining us here.
Thanks for having me.
Well, I want you to talk about your research that's been going on at the Öcare Copilot Institute about care guides and their role in healthcare.
So we had a study that took place early in 2012, actually, that was working with the original care guide model, and that was developed from an internal medicine doctor in our organization that was working with patients with chronic conditions. And what he was finding was that these patients were requiring a lot of work related to they needed transportation, they needed food, and that sort of thing. And he thought that that's who he was spending a lot of his time was on those issues. And he thought that's not what is best suited for me as a doctor. I need to be helping them with their chronic conditions. So he developed this notion and this idea of a care guide, a lay healthcare worker called a care guide, and developed this research study. And the research study went in pilot mode, and they saw really good results. That happened in 2010, and then launched into a full randomized control trial in 2012. And they built this care guide model around this lay healthcare worker, where they would be placed on the care team within a primary care setting. And that lay healthcare worker would literally sit in the waiting room and would have their patients that were assigned to them come through, and they might see them on their way into the doctor's office, or they might see them on their way out. But their key task was to establish a relationship with these patients and to best understand what it was that they were struggling with when it came to their real life. Mm-hmm. Their chronic condition was a part of their life. It wasn't their whole life. So these care guides were there to blend the clinical side of their health with their actual health. So they established a longer term relationship. They were that person that could be consistent over time. As these patients were only coming in every once in a while to see their doctor, they could call upon their care guide in between or in advance of their appointments to make sure that they were ready to meet with their doctor, really ready to take on the chronic condition. So they were focused not just on the clinical side of their health, but also the social, emotional, and mental side of their health as well. So that care guide model went through the randomized control trial in 2012 for a year, and the findings, they found that patients with a care guide were meeting their evidence-based care goals 31%. They were 31% more likely to meet their evidence-based care goals than the usual care patients, and they also found that they were 21% more likely to quit smoking, which was a great finding.
So that's interesting because, yesterday we talked about patient navigators. Today we're talking about care guides. There are other kind of lay workers in healthcare. Is it disparate? Are there just different roles? I mean, when you think about, how do you put that into context?
So what happened actually in the journey for Öcare Copilot Institute is we went through this randomized control trial, and we were tasked with disseminating the results because the results were great. They were finding that there were clinical outcomes that they were hitting. They were also finding that there was a reduction in hospitalizations and ED visits. So we were tasked with doing something with the research, getting it out into the field. And as we did that, we were realizing that there were a lot of different types of lay healthcare workers operating within healthcare delivery systems. And we started to wonder, how are they distinct? How are they different? And how are they similar? And so we started to do a lot of work on looking across these roles and realized that they share a lot of the same functions, yet they also are siloed often by role. So these roles exist, and there's very little support for the fuller workforce. So what the Öcare Copilot Institute has done currently is we're trying to figure out what is that, where are the shared functions, and how do we as a healthcare system and a delivery system support the fuller workforce. One of the things that we've done within Allina is we looked within our own system. So we were realizing nationally that these roles happen, whether they're community health workers or whether they're patient navigators or whether they're care guides, that all of these roles exist, and we needed to know internally in our own system what that looked like. So we did look across our own system and realized that there were a lot of these types of workers within our own system. They're just called different things. They do have distinct populations that they may work with, or specific diseases that they may work with, but they do share a lot of functions, and the underlying task that they're assigned to is building that relationship and the rapport with patients, inside and outside of appointments. So that's often how they are. They are the blend of somebody's real life. They exist and live in community, in their homes, within families, and their clinical life, where they have to engage because of a chronic condition or a specific disease state that they are experiencing.
And so are there clinical areas where lay caregivers work better than others? I mean, is oncology the ideal spot? Is it diabetes? Is it, is there a spot for them?
There are many spots for them, what we're finding, and I wouldn't say that there's any spot that they wouldn't work well in. Right now we are working with our own care guide model and adapting it across various settings. I think that's something that will continue to need to be explored. The care guide model was developed with the notion that these care guides would offer up a long-term relationship for patients. But as we've started to adapt the model, we knew it was successful in the research. We also know that there's an additional research study that's taking place using care guides to work with patients at the end of life, within the last 6 months to 2 years of life. And they're studying that. So how is that lay healthcare worker helping in that specific disease, in that specific area? But I would say we're still developing that, and they were developed with the idea that it would be a long-term relationship, but as we've gone out, there's interest in figuring out other diseases that they should work with. We were working with chronic diseases, but there's work in cancer. There's a stroke care guide within our own system that's working in the first year after a stroke with patients to make sure that there's appropriate follow-up. We have care guides that are working in the ED and urgent care. So it's a much shorter term relationship, and we're studying to see if that, even if it's a short-term relationship, if they're effective. And the point of that care guide is to get patients that are using the urgent care and the ED inappropriately to get them established in primary care. And so we're trying to see if a relationship like that on a shorter term basis actually has an impact on their goal, which is to get them into primary care. We're using care guides in our own system to reduce health disparities within US-born African American and Hispanic and Latino populations that are experiencing deep health disparities within our own system. So we're trying to figure out how to best use them. I'm not sure that there's a specific place or space for them right now. I think that the healthcare system in its current state, where we're really dealing with value-based care, that healthcare delivery systems are getting very creative in how they're using staff. They need to make sure that they are providing high-quality, low-cost care. This type of workforce, this lay healthcare worker workforce, is that space where they can provide really high-quality care at a much reduced cost to the systems.
Well, and you talked to me before we got on air here. I mean, you're expanding the kinds of care guides at Allina. Can you talk a little bit about what's the next kind of care guide that you're rolling out?
Well, I think the equity care guides that's really focused on health disparities is what we're in development right now of creating that model across our system. And like I said, we're going to be focusing on two specific populations, which is the U.S.-born African Americans and the Hispanic and Latino populations. So that's one model, and that is to reduce health disparities. The other is the Access Care Guide, which is sitting in the urgent care and emergency department within our system. And then we are also using care guides within care management. And so the goal of those care guides is to keep the most at-risk patients from getting readmitted. And then we're also using the stroke care guides. So that within our own system, we're seeing adaptations taking place. The life course care guides, which is the end of life care guides, are that's the other big research study. So we have a lot to learn from that study in and of itself. The model was developed, and then they brought the care guide in because they thought that it could really add something to that model. And in that model, very early on in the research, we're in the midst of it right now, but they're seeing that there's actually an impact on total cost of care in a good way. They're seeing that they're saving about just over $800 per patient per month in that model. So it's going to be exciting to see how that unfolds and how that continues to unfold.
Well, that number was interesting. I mean, that's a real hard number of value of care guides. I mean, do you think that will carry on?
I'm hoping
patient?
so.
Yeah.
I mean, we're like I said, in the midst of the research. It's very early on, and it's a little scary to use the number, but in reality, that's what they're seeing. They're doing, and I think that's what people want to see at this point is what is the value. We can't walk into a room right now in the current healthcare state and have somebody not ask about cost or value when it comes to anything that anything new that's coming along. And these lay healthcare workers, some are deeply research based, and some are created out of sheer need, and they are effective in many ways. So we have to, but the next question becomes then how valuable are they? Like, what's the value meaning? What's the cost benefit to our organization?
And the new care guides that you're going to have address healthcare disparities. How many are you hiring? What are their specific duties, if you can go into that a little bit?
They are going to be, we're hiring 2 at this point, and they're working across several clinics within our system. And they're going to be actually paired with a certified diabetes educator to work with these patients because they all have diabetes. So they're going to be the folks that connect to community resources that exist around that these people, the patients, need in their community, along with the connection to the clinical side of things. So their task is going to be to understand what's getting in the way of potentially eating well, what's getting in the way in terms of your transportation, and how can we support you in that way. And they're going to be an extension of the diabetes educator in terms of how they, if there's a plan that the educator puts into place, then how can they support that plan? That's going to be their primary task.
It's fantastic. I want to thank you for talking about care guides with us. We've been having these kind of candid conversations all through Engage. I hope that you enjoyed this conversation. For Melissa Hutchison, I'm Chris Seper. Thanks again for doing this.
Thank you.
Take care.